In a time when information is critical, it's important for us to bring you the facts, not fear. We spoke to a health expert to answer the questions and concerns you have about the coronavirus. So hello everyone, I'm Camille Riquiesas. I'm speaking with Dr. Payal Kohli, who is a health expert, a doctor as well. Dr. Kohli, hello, and can you tell everyone just a little bit about your background and your medical background as well?
Yes, so I'm a Denver native, and I went to medical school at Harvard. I also did my residency in internal medicine at Harvard, and then I trained in cardiology. So I'm boarded in both internal medicine and cardiology, and I'm excited to be here today.
Thank you so much for joining us here on Fox West Texas. I'm just going to ask some of the general questions just in case people don't know exactly how does the coronavirus or COVID-19 spread and who's most susceptible to that?
Yep, so the COVID-19 virus is transmitted primarily through respiratory droplets. So that's thought to be the main means of spread. Now, additional studies have come out that have shown us that it may also spread by fecal oral spread, which means basically if you go to the bathroom, you have the virus and you don't wash your hands and then you prepare somebody's food, it's possible, it could spread that way. And there's some preliminary studies also potentially saying that it may spread through aerosolized particles. But all of those other means of spread are thought to be minor, and the primary mode of transmission is through either direct contact with somebody, like shaking hands or hugging them, or through respiratory droplets like a cough or a sneeze.
Okay, so then if we do go out to a restaurant and we get some takeout food, should we be worried about that at all? Do you think we can get the virus that way?
Yeah, so a lot of restaurants are closing, and it's an important question to ask. So we don't know how much higher the risk is in terms of takeout food, but we do know that it's probably higher than food you prepared at home. So if you go to a restaurant and the person preparing your food has the virus and the food could be contaminated, or potentially the utensils that it was prepared in are contaminated, then it is possible that you may be able to contract the virus through the food. So it's a slightly higher risk. But again, a lot of it depends on who's preparing the food and how many people have handled your food. And so the safest thing to do would be to prepare your food at home, but the risk of takeout is probably slightly higher.
And is there a reason to panic at all? I was listening to an interview that you did earlier, and I think you were talking about emotional contagion. Is this the reason why we're panicking,
Yes.
or is there a real reason as to why we should panic about the coronavirus?
Yeah, so, there's no reason to panic, but I have to say that panic is probably the natural kind of first response, but we really need to have control over that. And the reason is because we're in unprecedented times. We're doing things that our country has never done before. We're closing down restaurants and public places, and we're asking people to stay home. And certainly this is new territory, and I think that has a tendency to induce that kind of fear or panic response because it's an uncertain thing. But I really want to empower people to really come in control of their emotions, because emotional contagion is the concept that emotions are contagious, just like the virus, and they can actually spread faster than the virus itself. And so instead of spreading negative emotions like panic and fear, I really want this to be a time where people start to spread emotions like community togetherness, selflessness, thinking about others, and thinking about empowerment, because our behaviors are going to control how this virus spreads. So yes, it's an uncertain time, but it should really reassure people that, number one, we're all in this together, and number two, that both the state and local governments are really trying to get ahead of this thing, and we're all kind of learning together. But it's not a time to worry, it's more a time to really be mindful of how you're responding, because your responses are going to influence how it spreads.
And speaking of our responses, they are talking about, there's been a lot on the news about social distancing. The CDC just announced that we shouldn't be in groups larger than 10. What really is social distancing, and why is it important? And how long do you think we'll have to distance ourselves from others?
Yeah, so great question. So I cannot emphasize the importance of social distancing enough at this time. And let's talk a little bit about what would happen if we did nothing. So let's say we went about our lives as usual and did absolutely nothing. 60 to 70% of the world's population would become infected with this virus. Wow. And out of those, 20% would need a hospital. And so if 60 to 70% of people became infected with this virus at the same time, you can imagine our hospitals are not set up to take 20% of those people and hospitalize them. So the importance of social distancing and this flattening the curve that you keep hearing about is really to spread out when people get the virus and to decrease the total number of people that get the virus, because the virus doesn't spread itself. People spread the virus. So really, as I said in the beginning, what's spreading the virus is direct human contact or contact with respiratory droplets. So if you space people out and have at least 6 to 8 feet between people, or just spread them out and minimize contact, the virus is unlikely to spread. So as an extreme example, if the entire world got locked down for 14 days and there were no new cases of the virus, this thing would be over. But of course, that's not practical. That can't happen because people have to take care of the ones that are sick. And so that's the reason we continue to see kind of more and more new cases coming up every day. But the social distancing piece is so important right now because it's going to do several things. One, it's going to decrease the number of people that are infected altogether, decrease the burden from the virus. The second is it's going to protect the vulnerable people in our society. So the healthy people are generally the vectors, the way that the virus spreads to the vulnerable people who are the older people, the ones with medical illnesses and such. And the third thing it's going to do is really protect our healthcare system so that it's able to deal with an influx of people in a graded fashion. So what's happening in Italy right now is that they got a large bolus of cases altogether because a lot of people got sick because they didn't really practice a lot of that social distancing when they were on the steep part of that curve, and the cases were increasing quickly. And now the hospitals and doctors are having to make the tough decisions of, who to save. If they've got 2 people and 1 ventilator, how do they accommodate that? So in order to prevent that from happening, we really need all hands on deck doing the social distancing, particularly the young, healthy people.
And you were talking about that curve. I'm wondering, I know Italy is at the steep part of the curve. Are we at our peak yet, or are we not? And when do you think that's going to happen?
Yeah, unfortunately, we're not at the peak yet, and we're just getting onto our steep part of the curve. So in the last 24 hours, we had 1,000 new cases in the United States, whereas Italy had 1,100. And in Wuhan, China, which is where this all started, they only had 1 new case. So they're on their way down, and we're certainly on our way up. And again, we want to blunt how fast we're getting up there with the social distancing. Right. But we anticipate the peak of the curve is probably not going to come for the next several weeks. And if we start to blunt the curve, so instead of going up like this, it's going up like this, we actually broaden the time of the peak. So, when you have a sharp peak, it's actually a shorter period of time because everybody gets sick quickly. But when you blunt that with social distancing, you may actually prolong the time that you have to do the social distancing. But overall, you reduce the number that are infected. So as President Trump said yesterday, it's possible that this could last us well into the summer. CDC is also predicting that the virus may actually be around till the end of the year or maybe into next year. It may even become a virus like the flu virus that we go to get a vaccine for. So it's important that we really start to embrace some of these behaviors now, because unfortunately for the next several weeks, they are going to be a part of our life, and it's going to be important to prevent the spread of the virus.
Okay, so that's going to be our social responsibilities to make sure we stay distant from family, friends, people who are susceptible. If we don't have any symptoms of the coronavirus, can we still spread the virus around?
Absolutely, and that's a very important thing to know, that 80% of the people will actually have mild cases or no symptoms at all, and those are the people that are actually the spreaders because they run around feeling well and spreading it to others. So some people will have no symptoms at all and still be spreading the virus, and that's called asymptomatic transmission. And some people will spread the virus before they realize they're infected. So it usually takes about 5 days or so for the symptoms to start showing up after you get infected. But that's called pre-symptomatic transmission. So you're infected, you're positive, you're infecting others, but you don't have symptoms yourself. So even if you're feeling well, even if you have no symptoms, it's really important to do the social distancing to protect others, but also to protect yourself, because someone else that you're with could also maybe have no symptoms and potentially be spreading the virus.
And we were talking about groups of people who are more susceptible to getting the virus. Are pregnant women more vulnerable to the virus, and are babies as well?
Yeah, so pregnant women are certainly considered a high-risk category. And we have very limited data on pregnant women because there are not that many pregnant women that have gotten it. But what we've seen in case studies that have come out of China from 9 pregnant women that all contracted the virus, this was late in pregnancy, so 3rd trimester. And what we saw was basically that they all did relatively well. So they don't seem to have a higher rate of getting infected. When they do get infected, they also don't necessarily seem to have a higher rate of complications. And they also don't have maternal complications like miscarriages or preterm labor. But again, the sample size is very small. We only have 9 women to work off of. This is very different from the SARS virus, which had a very high rate of maternal complications with a lot of miscarriages and preterm labor. And genetically, the COVID-19 virus is very similar to the SARS virus, about 75 to 80% identical. So a lot of what we're thinking happened with SARS may also happen with this. And we worry especially about the women who are in the 1st or 2nd trimester of their pregnancy, because that's early in the pregnancy and we really don't have much data on those women. Pregnancy is also an immunocompromised state. So because mom has the baby inside her, mom's immune system actually turns itself down a little bit in order to not, attack the baby itself. So women who are pregnant generally have a higher risk of respiratory infections, but with the coronavirus, because of the small numbers, we just don't know yet.
Okay. So do you
Oh,
think...
and then you had asked about I'm
go
sorry,
ahead.
you had asked about babies as well.
Yes, ma'am.
So I was just going to say, with respect to babies, also we have a very small sample size, but what we have seen is that mom doesn't generally tend to pass the virus through the placenta to the baby. There's
Okay.
also no evidence of viral particles in the breast milk. Having said that, when mom is kind of holding the baby, and because it's a respiratory virus, there have been case reports of mom infecting the baby through close contact with the baby. Now, the babies that do get it, and we have, again, a case report of about 9 babies that have contracted the virus, they generally tend to do remarkably well, and actually none of them have ended up in the ICU or died from getting the virus.
Well, that's good to know. I guess we're talking about babies now, and with the extension of spring break, daycare facilities and taking care of your kids, should daycare facilities do you think they should close down? I know we're seeing a lot of schools closing down, sports events. Should those close down as well?
In my opinion, I think they should, because I think the daycare facilities are very similar to the schools themselves. And again, the risk to children themselves of infection is relatively low, but the worry is that kids may end up being asymptomatic carriers, so they may actually take the infections to the adults. And similarly, the daycare facilities with their teachers and other staff that they have can actually cause, prevent social distancing and cause spread of the virus. So I think in order for this to really work, like I said in the beginning, everybody's got to do it, and we've got to do it kind of universally across the board. So I think daycare facilities are certainly something we should consider closing down for the time being.
Because we should do social distancing, but it's not going to work out as the way we should ideally, how long do you think this is going to last? Will it be a few weeks or a few months of social distancing?
Yeah, so I think that's a really important question.
Yeah.
And I think aggressive social distancing, which is what we're doing now, what we saw in San Francisco, they said everybody should take shelter and stay inside.
Right.
That kind of aggressive social distancing, I'm hopeful, is only for a short time, like a few weeks, like 2 to 3 weeks, until we can blunt the spread so that we get ourselves off the steep part of the curve and get on the flat part of the curve. But the concept of social distancing with just in general, avoiding handshakes and keeping a good distance when you're talking to people, that's going to last for several months and maybe even last into, like I said, next year.
Okay.
With viruses that are transmitted through respiratory droplets, this has always been something the medical community has kind of advocated. The reason that we're doing it so much more aggressively for the coronavirus as opposed to the flu or any of those others is because it's a new virus that nobody has immunity to. We don't have a vaccine. We don't really have a treatment or an antiviral. So this social distancing piece is buying us time to slow the spread so that we can develop the vaccine, develop the antivirals, and really learn more about the virus in the meantime.
And are you hopeful that we will find a vaccine for the coronavirus?
Actually, I'm really optimistic and hopeful. So yesterday was the first day of the phase 1 clinical trial for the vaccine in a human. And,
okay.
I have been very impressed, which was a big breakthrough. And I've been really impressed with the timeline of vaccine development, which usually takes several years. And it's really been expedited during this pandemic. So I'm excited about that. We're still several months away from having a vaccine that we can actually use out in the general public, because now that it's entered clinical trials, they have to prove two things. First, that it's safe to give to a large population,
right.
and second, that it's effective, that it actually works. And so that's what they're working on doing now. But I'm really optimistic that we're going to have a breakthrough on that hopefully soon.
When you first heard about the coronavirus, I'm just wondering from a medical professional perspective, were you surprised, worried at all? What were your thoughts?
When I first heard about it, I have to tell you, I wasn't particularly alarmed, and that's because we've had other types of coronaviruses like the MERS virus in 2012 and the SARS virus 2002, 2003 that have come out similarly because of mutations and such, and then they kind of die a natural death because they're relatively contained. But there are a few key differences with this particular virus that kind of let it get ahead of us. I think the first is that, it spreads at 2 or 3 times the rate of the flu. So the flu is, if you get the flu, you infect one other person. With this COVID-19 virus, if you contract it, you're likely to infect 2 to 3 other people. So it spreads faster. The other part of it is that the SARS virus was significantly more deadly. So in a morbid sort of way, people weren't around to be spreading the virus, because if they caught it, they were, likely to die from it or have severe complications. Whereas in this case, because 80% of people tend to be relatively asymptomatic or only have mild symptoms, people were actually spreading it before we even realized that there was a new virus that we had on hand. So I think initially when I heard about it, I wasn't particularly alarmed, but in the last 3 or 4 weeks, we've really seen that inflection point where the medical community, the physicians, and the country as a whole have really amped up the degree of aggressiveness in terms of spreading this, because now it's no longer just in China or just in Asia. It's here in the United States, and it's a reality, and it's spreading through the community.
And I just want to reiterate, just because we're amping up our precautions on what to do, that doesn't mean we should panic or worry, right? And what are the other things that we should be doing just to make sure that we don't spread the virus?
So I think it's really important what you said, don't panic and don't worry. That's the biggest piece of it, because if you start to panic, you lose your logic. You lose your ability to think rationally and to think clearly. And, like I said before, we're all in this together, and it's really important for us to start to spread positive emotions. Now, the reason that we're being so aggressive about this is not necessarily because it's such a scary thing, but more because we all need to get on board with this in order to really control it. But there are 2 levels of things we can do to stop spreading the virus. One is kind of individual decisions, and the second is community level decisions. So I'll talk first about the individual decisions, which is the things we had said in the beginning. So extremely good hand hygiene. Be sure to wipe surfaces down and let the products dry on the surfaces. Be sure to, not share utensils and things like that with somebody else. Stay home from work if you're sick or have any symptoms at all. Those are individual level things. Then there's community level things that we can do that the government has also been kind of encouraging us to do, which is to avoid large gatherings. And now many of those gatherings have kind of been done away with. I know that the president said yesterday, avoid gatherings of greater than 10 people, but I think even gatherings of 2 or 3 people confer some risk. So even if you're getting together with your family for dinner or anything like that, make sure you do maintain that distance, because when you're interacting with somebody, you are not just interacting with that person, you're interacting with every person that they've interacted with. So, this is particularly true for the high-risk groups, and those are the elderly or those with chronic medical problems or pregnant women. But even for everyone else who's healthy, it's important to keep in mind that, you want to maintain that distance, you want to avoid group gatherings. You really want to be mindful of your reasons to leave the house. And so this is not life as usual, unfortunately, for the time being. So you don't want to just get out there, start running errands and doing things without thinking about where you're going, because that's going to expose you to potential risks. So I would say at this point, really only leave your house for essential things like medications or groceries. And if you do have to leave your house, really, again, maintain that distance in order to do so. Now, during the time that we're all kind of hunkering down and staying at home, I do want to emphasize that it's important to get regular exercise. It's good to get outside, actually. There's no reason you can't go outside. But if you do go outside, just be mindful of touching park benches or touching railings or surfaces that may not be cleaned regularly where the virus could be stuck, and be careful again of interacting with others in a close fashion.
Okay, so you could still live your life, just don't be so close to other people and make sure everything's clean. Good to know.
Right. Exactly.
You mentioned medications earlier. Is it okay to take ibuprofen? Let's say you're starting to have symptoms of the coronavirus, or does that have any effect on the coronavirus?
Yeah, so that's a really good question. So some research published actually just last week has raised concerns about ibuprofen. So ibuprofen is a class of medications called non-steroidal anti-inflammatory drugs. And this medication is believed to maybe upregulate the receptor that the virus uses to get into the lungs. So there's some theoretical possibility that because that receptor is upregulated, you're increasing the susceptibility to the virus. Now, this was all done in animal studies, and it really hasn't been proven as much in humans. But again, we're still learning about the virus. So some experts are saying that it's probably better to avoid ibuprofen if you're feeling under the weather and instead take Tylenol first. But if you have any questions or if the Tylenol's not working, then definitely talk to your doctor about that.
And does the coronavirus have any other effects, not just physical effects, but are there any emotional or mental effects on a person?
Yeah, actually, it does have a lot, and pandemics in general tend to do that. And we talked already about panic, fear, and anxiety. There's also this whole concept of social distancing creating loneliness, which is a real problem, and we're encouraging people not to interact with each other, and that can really make you feel lonely, particularly those elderly high-risk groups, because they already tend to be socially isolated, and now they're even worried about contracting the virus. The other people that are very high risk for having these type of mental effects are kids and adolescents, because they may not understand, what's happening, why it's happening. And a lot of people during difficult times like this turn to increased alcohol use or substance abuse, to help them kind of cope with the economy, with the uncertainty, with this, every day we keep hearing about things on the news. So I have a couple of coping strategies that I would recommend. First, just kind of know that these emotions are normal and that they're going to pass. But if you feel like you're having them in the extreme, I think it's really important to reach out to your doctor or your mental health provider. But if you think you can manage it at home, I would suggest, number one, finding something to laugh about every day, which is a difficult thing to do in this kind of a public health crisis. But see if you can just find something to either laugh about or reflect positively on. So I personally am doing a lot of journaling, and I write down one positive thing, and the positive things being things like the community has come together to really fight this thing. You hear stories of people helping their elderly neighbors with their groceries and things like that. So I'm finding all of that very positive and shows the humanism in people. Another thing you can do is to keep your faith. So especially at a time when churches are closing and church services closing, is just kind of have faith that this is going to be temporary and that it is going to pass. And then mindfulness and meditation has actually proven to be very effective as well in combating a lot of these emotions. And that's just like deep breathing and kind of staying in the present moment so that your mind doesn't kind of run away with you about what's going to happen.
Oh, do you think something like yoga could also help in this situation?
Absolutely. So yoga is not just good for the physical body, it's also good for the mental body. And of course, if you're going to do yoga, then you do it from your home and do an online class, because we're talking about social distancing at this time, so you don't really want to be going to classes to do that.
Right.
But it's important to keep your physical body healthy as well, and stretching and things like that can also really help to relax some of that tension that this virus is creating.
Okay. For people who may be sick at this time of year and it may not be the coronavirus, how long should they stay away from people once their symptoms have subsided?
Yeah, so that's a really important question, and there's a lot of overlap between the flu and the coronavirus, for example. There can also be some overlap between things like, allergies that can cause a
Right.
post-nasal drip with a cough. So if you're not getting tested, the best thing to do is to get tested, because then you know exactly whether you have the coronavirus or not, and then you could basically go back out once you've had 2 negative tests that are at least 24 hours apart. But if for some reason you haven't gotten tested or you can't get access to a test, then it's important to wait at least 1 week after your symptoms have subsided in
Okay.
order to start going out again, because you want to make sure that you're not infectious at all. But if you have a specific question, you should talk to your doctor about that one.
And speaking of tests, I heard that there's a limited amount of tests. So who gets tested? How do doctors decipher who gets tested, and where can you get your tests? And are they limited?
Yeah. Yeah, unfortunately, they are limited, and that's been one of the challenges in battling this virus. In other countries, they're actually doing, in South Korea, 10,000 to 15,000 tests a day, whereas we've done that amount in the last month. So that has been a personal frustration of mine as a physician, because it's sort of like fighting a fire blindfolded. Not knowing the extent of the disease can really impair our ability to control it.
Right.
Having said that, at this point, the guidelines are essentially been relaxed to allow for slightly more testing, but still, you have to have symptoms. So people who are not having symptoms are not being tested. If you have symptoms, it's up to your doctor to decide whether they feel like they're typical enough for coronavirus, and those, just to remind you, are fever, cough, and shortness of breath, the top 3, or if they're very atypical and they suggest something else. And sometimes, if your flu test comes back positive, or your other test for other types of viruses that cause colds come back positive, then they may not test you for the coronavirus. But it is theoretically possible that you could have both. So if you have symptoms, I think it's important to talk to your doctor about whether or not you need a test. But the decision is ultimately the doctor's.
Okay. That's really interesting. So they could have both coronavirus and something else? Is that what you're saying?
You could. I mean, it's
my
a low
goodness.
likelihood, but
Okay.
but a lot of people that are getting into the hospital with coronavirus, there are a handful of them, a few cases that are getting what we call secondary infections. And so coronavirus can basically take over, because your immune system is so busy fighting the virus that you can actually develop a secondary infection like a pneumonia or something else. And that's why it's important to make sure you've gotten your flu shot, make sure you've gotten your pneumonia vaccine, because those are the other things that can affect you in addition to the coronavirus.
That's certainly good to know, especially if you
Yeah.
don't think you have it and then it turns out you have both. That Okay,
Right.
so you're going to want to see your
Right.
doctor if that happens to you.
So if you have symptoms, see your doctor, basically. That's the
Okay.
bottom line.
Good to know.
Yeah.
I'm sure you've seen pictures, or you've probably seen at the grocery store, where there's not a lot of stock of the necessities like water, toilet paper, and whatnot. My question is, should we be worried about stocking up on necessities even if we don't have those symptoms of the virus?
Yes, and the answer is you should. And the reason is not so much because they're going to run out, but the reason is that if we do what San Francisco is doing, which is asking everybody to stay home for 2 weeks in order to slow the spread of the virus, it's going to be important for you to have those supplies. So what I generally recommend is kind of 3 categories of things. The first is prescription drugs. You want to have at least 2 to 3 months of that on hand, because some of those are, made in China or have ingredients that are made in China, so you don't necessarily want that to get interrupted if you're taking prescription drugs.
Okay.
The second is household products like paper towels, toilet paper, cleaning products, all the things that you normally need to kind of run your house, batteries and things like that. You want to have at least a 2-week supply of those. And then the final is food, like things that are canned goods and pastas and things that can have a prolonged shelf life. Some people are buying, powdered milk or other types of things like that you could, if you were stuck inside your house for 2 weeks, have enough food to kind of, sustain yourself without having to go out.
Okay. I think that's all the questions I have for you, Dr. Kohli. Do you have anything else that you think the public should know regarding the coronavirus?
I think that it's really important to remember that this is a really rapidly evolving situation. If you think about the last 2 weeks, our lives have changed in the last 2
Right.
weeks, and the next 2 weeks could see similar types of change. So I think one of the things you can kind of mentally do is to prepare yourself for the unexpected, and really recognize that because things are evolving so rapidly, the advice today could be different from the advice tomorrow. But just make sure you don't spend too much time on social media and don't panic too much, and just really take it one day at a time like we're all doing.
Thank you so much, Dr. Kohli, for taking the time to speak
Okay,
with
thank
me.
you.
It has been very
My
enlightening.
pleasure.
I hope you have a great day.